Good afternoon, everyone. The Secretary to the Government of the Federation and Chair of the PTF, Honorable Ministers, Director General, Permanent Secretaries, ladies and gentlemen. Saturday, the 6th of June 2020, marked 100 days since the first confirmed case of COVID-19 was diagnosed in Nigeria. In that period, we have seen a lot and learned a lot about this novel virus, about which so little was known at the inception, and about which not yet all is known at the moment. I used that occasion to give a live update on our nation's response on the Federal Ministry of Health social media platforms. It was an update and a situation analysis. In these 100 days, we have tested over 76,800 persons, recorded 12,486 confirmed COVID-19 cases in 35 states and the Federal Capital Territory, successfully treated and discharged 3,959 persons, but sadly lost 354 Nigerians, most of whom had underlying illnesses. May their souls rest in peace. We commiserate with their families, and as we do that, we also appreciate our healthcare workers who put their health, their lives on the line, and do all they have been taught to do to keep us safe. Our response during this period was focused and targeted at the initial phase on screening travelers at points of entry, testing for virus importation, tracing their contacts, and isolating positive cases. It seemed with that we were safe for a while. But since our entry into the community transmission phase, we have begun to see more figures rising, and has also caused us to become more aggressive in tracking and testing and increasing our laboratory network capacity from 2 at the start to 30 molecular laboratories, with a plan for at least 1 laboratory in every state. This way, the turnaround time will be reduced to a minimum, and case finding and management will run more smoothly. The management of infected cases is being reviewed regularly and improved, with revised clinical guidelines to be published in accordance with learnings and evolving dynamics associated with COVID-19 and global best practices. This includes new discharge protocols, treatment regimen for asymptomatic or symptomatic cases with various clinical manifestations. We continue to collaborate with all states and Federal Capital Territory with regard to their management of cases, with provision of commodities, training, and other technical support where needed. A 2-day webinar held on the 3rd and 4th of June on the effect of COVID-19 on health and care management of the elderly was conducted in collaboration with the West African Health Organization, and it took a critical look at various aspects of the impact of the disease on the elderly, who are usually at higher risk of infection. The outcome of the webinar provides grounds for policy direction for care of the elderly during and beyond COVID-19. The general recommendation still remains that senior citizens, being vulnerable, should stay home most times, and if they have to go out, wear a mask once outside their homes. This morning, the Federal Ministry of Health received the report of the ministerial task team that went to Kano to support the government there in the COVID-19 response with commodities, ambulances, training, technical and confidence building measures. The visit turned out to be a game changer and improved the indices for Kano. It was extended to fact-finding missions to offer support to 5 other states in the northern part of the country, where the impact was also very well valued and visible. With the observations and recommendations from the 3-week assignment, the committee developed a strategic incident action plan to strengthen coordination capacity of the health workers and improve community engagement in line with our response plan. We know that the healthcare workers in Kano and many parts of the northern areas of our country had become very jittery at the advent of coronavirus disease and had stopped or slowed down attending to other patients, which led to complications in the healthcare delivery. Moreover, many of them had become infected, and while over 150 health workers had been infected at the time of the arrival of the team, after they conducted their training on infection prevention and control, there was no report of infections among the healthcare workers who had received training. This way, their confidence was restored and service was also restored in essential and routine case management and also COVID-19 management. With regard to the unexplained deaths in Kano, which occurred in April over a 5-week period, the team confirmed that a total of 979 deaths were actually recorded in 8 municipal local government areas in the state. And at a time, at a rate of 43 deaths per day, as measured by counting activities at the graveyards. The peak was in the 2nd week of April. And by the end of April, the numbers had started to reduce and had finally now settled at 11 deaths per day, which was about what it was before. The verbal autopsy that we spoke of revealed that about 56% of the deaths had occurred at home, while 38 were in a hospital, and with the circumstantial evidence as all to go by, the investigation suggests that 50 to 60% of the deaths may have been triggered by or due to COVID-19 in the face of pre-existing ailments. A significant part was also triggered by inability to access routine care at the time due to the scare of COVID-19. Most of the fatalities were over 65 years old. I wish to thank Dr. Guazo, Professor Nasidi, and members of their team, particularly those who came from Irua, for diligently carrying out the assignment. It is gratifying to note that they all returned safely and had no incident of contracting infection. I must also commend His Excellency, the Governor of Kano State, for the full support he gave to the team to achieve their targets. Finally, I wish to again remind everyone that wearing your face mask at all times in the public, or even inside your house when you are not sure of your visitors or your company, or if you are in a crowded environment, is a very valuable safety precaution for you, your family, and your friends. I also urge everybody, as I do every day, to observe your respiratory hygiene, especially when you are coughing or sneezing. Use a tissue, please, and discard it immediately after. Use sanitizers as often as you can, and observe physical distancing. Thank you all for your attention. I shall now invite the NCDC Director General.